Okay, we're continuing with your health assessment. We checked your ears and your mouth and your nose. When we checked your ears, we did the voice test, also called the whisper test. That was checking your cranial nerve number 8, your acoustics. And that cranial nerve is working because you passed the whisper test, okay? So now we're going to look at your mouth. First, I'm looking at your ears. I'm sorry, your lips. I already washed my hands. First, we're looking at your lips. They are intact, moist, no lesions or sores noted, no inflammation noted. Open for me. I'm going to pull down. I'm looking at your buccal mucosa. It's pink and moist and intact, no lesions or redness noted, no bleeding. Do you have any problems chewing your food with your teeth?
No.
Any problems swallowing?
No.
Do you have any teeth missing?
No.
Okay, go ahead and open up for me. Okay, all teeth are present, intact. Gums are pink and moist, no inflammation or bleeding noted. Go ahead and stick out your tongue for me. Okay, move it up and down and around. Okay, that is your cranial nerve number 11. That is your hypoglossal cranial nerve number 12, I'm sorry. That is moving around of your tongue, so you have tongue movement, hypoglossal cranial nerve. Go ahead and stick your tongue out for me again. It is pink and moist and pink with even distribution, no lesions or sores noted. That's good. I'm looking at the top of your mouth is your soft and hard palate. The hard palate is the one that shines, reflects white, and the soft palate is the one that reflects pink. Your palate is intact, not inflamed, moist, intact. Okay? Sometimes you ever look in the mirror and you see that little uvula back there hanging, little thing hanging. Mm-hmm. That's a uvula, and you'll see two little balls on the side. That's your tonsil. So I'm gonna look at that next. Open up for me. Go ahead and stick your tongue out and go, ah. Very good. That is cranial nerves number 9 and 10. 9 is your gag reflex. That is, go ahead and stick it out for me again. 9 is your gag reflex. That's your glossopharyngeal. And that does the gag reflex. That you did assists with that. And cranial nerve number 10 is your vagus nerve, and that helps with swallowing. Go ahead and open one more time. It is intact. And your tonsils are a +1, mean they're there, but they're not touching anything and they're not touching each other, okay? All right. Let's take one more look, make sure we got everything. Very good. Now we're going to check your thyroid. Thyroid is in your throat. What I'm going to do, I'm going to come around behind you and put my hands on your throat. Not going to choke you or anything. What I want you to do when I tell you is take a sip of this water, and I'm going to palpate your thyroid, okay? Mm-hmm. So I'm putting my hands. Can you just kind of stick your neck out for me? Put in my hands here. Okay, tilt your head slightly. There we go. Go ahead and take a sip of water and don't swallow till I tell you. Okay, swallow. Okay, I felt your thyroid. I was able to palpate it. Now let's do the same thing on the next side. Okay, go ahead and take a sip of water. Now I'm going to palpate. Swallow. Okay, your thyroid was felt. When I palpated it, I felt it when you swallowed, but it went right back into midline. So was there any pain when I did that?
No.
Okay, thyroid is present. No inflammation or pain noted. Okay, I'm going to go ahead now and look at your back. This will look at your post and interior chest. So the back here is your posterior chest, okay? So I'm going to inspect. I'm going to be touching. Skin is intact and clean. No lesions or bruising noted. The thoracic cage appears with symmetry on inhale and exhale. We'll go ahead and listen, and then we're going to percuss. So when I tell you, take a deep breath in and out. Deep breath in and out. Okay. Another one, deep breath in and out. Okay, again, deep breath in and out. And one more time, deep breath in and out. Very good. Lung feels clear to auscultation in all lung fields. Next thing we're going to do is percuss. Down here is your kidneys. You have one on each side. What I'm going to do, I'm going to put my hand here, and you're going to feel a thud. You should feel a thud, but no pain. We do this just to check like maybe something going on with the kidneys, okay? No. So you're going to feel a thud. 1, 2, 3. Any pain?
No.
Okay, and then we have a kidney on this side, so we'll do it again. Any pain?
No.
Okay, that was checking for CVA tenderness. Now I'm going to check in the front. So I'm going to do the same thing in the front, inspect. Appears with symmetry on inhale and exhalation of the rib cage. Skin is intact with no bruising noted. no open sores. So what I'm going to do, I'm going to palpate. And the way I'm going to do this, you put your arms by your side, put my hands here with my thumbs pointing towards your xiphoid process is where they do CPR. What I want you to do is take a big breath in and out for me. Let's do it one more time. Okay, very good. Symmetry noted with the chest inhale and exhale. Okay, I'm going to go ahead and listen. Okay, deep breath in and out. Very good. Again, deep breath in and out. Very good. So I'm going to go down lower. Deep breath in and out. Deep breath in and out. Very good. Any pain when you did that?
No.
Okay, very good. Now we're going to check your heart. Just listening for your heart sounds. We're listening for S1 and S2. They're called the lub and the dub, okay? So first thing we're going to check is your carotid artery. You have a carotid artery running on the side of your neck. So I'm going to take my finger and put it here. And I'm just feeling for the pulse like we did on the lymph nodes. Well, palpate it like we did on the lymph nodes. Strong pulse on that side, not weak or thready. Check this side. Strong pulse, not weak or thready. And I'm going to go ahead and listen. Also take your carotid artery using the bell of my stethoscope. I'm checking in 3 spots. Very good. I was checking for a brewery, which is just an abnormal sound of the blood rushing through the vessels. I did not hear that, so that's a good thing. Now I'm going to go ahead and I am going to listen to some heart sounds, okay, in different areas on your chest. First one we're going to find is your aortic. So I'm going to go down 2 intercostals. That's the way I measure it. And I'm going over to the right. This is your aortic area. Listening for S1 and S2. Directly over to your left, pulmonic area. Down 1 intercostal to Irby's point. Okay. Down another intercostal to your tricuspid. Tricuspid. And then over costal midclavial margin, I'm going to go to your ventricle. S1 and S2 heard in all areas. Now if you lay back for me, I'm going to do the same thing with you laying back. And it's a supine position. First thing I'm going to check for is the palpate of your apical pulse. It's located at the apex of your heart, in between the 4th and 5th intercostal. So what I'm going to do again, do my measurements. 1, 2, 3, 4. And I'm going over to the apex of the heart. Now take a deep breath for me and just hold it. Okay, you can let go. I felt the palpation of your apical pulse. It was short in duration, about half of a systolic, which is a good thing. So I'm going to go ahead now and listen to those same areas again, starting with the aortic area. So I'm going to go down 2 intercostal on your right aortic area, directly across pulmonic, down 1 intercostal to Irby's point, 1 more intercostal down to your tricuspid, and your mid-clavicle coastal region over your ventricle. Now we're going to check for a murmur, or sometimes called an S3. So what I need you to do is turn over on your left side. Can you slide over to the edge for me? There we go. You got that arm out? There we go. All right. I'm coming down to your 4th intercostal, and I'm just listening for any extra sounds. No S3 noted, which is a good thing, on your left lateral. Okay, go ahead and lay flat on your back. I'm going to go ahead and check your stomach while we have you laying down. Okay, your stomach is split into 4 quadrants. And what first we're going to do is inspect. Pin light. It is uniformly round with a sunken umbilicus. And I see a few striates, which are just stretch marks, and I see them pink, which means they're new. Sometimes when we eat a lot, it kind of stretches our skin. So that's what's that from. And I'm going to go ahead and listen. And I do see a slow wave, meaning our peristalsis is working. Okay, I'm going to listen to each quadrant. You have 4. Vowel sound active in all quadrants. Okay, I'm going to percuss, which is the light tap, and I'm going to go in a clockwise motion. I'm checking for Tiffany. That's just hollowness of your organs, okay? Let me know if you feel any pain. And I'm kind of going to go in a in and out motion to make sure I get everywhere. Any pain?
No.
Okay. This is percussing for Tiffany. Okay, Tiffany felt in all quadrants. Now I'm going to do a deep palpation and a light palpation. First one's going to be light, just a gentle rotation, okay? I'm feeling for anything that might be sticking up, lumps, hernias, anything that shouldn't be there. This is the light palpation. It's going in a circular motion. And I'm only going 1 centimeter. Okay, now I'm going to do a deep, which you will feel more. This one goes about 5 centimeters, okay? Just making sure the organs are where they should be. This is a deep palpation. Any pain?
No.
Okay. Okay. Finish that. Okay, while you're laying down, we're going to go ahead and check your hip joints. See if we feel any clicking or any movement. Do you have any pain when you move your legs?
No.
Okay, very good. I'm going to check your pedal pulses while we're here too at the lower extremity. So we'll do that first. First, you have a femoral pulse that's running right here. So what I'm going to do is feel right here forward. These are all your pulses in your extremities, lower extremities. Strong pulse felt, not bounding or thready, and I will feel on both sides for symmetry. Then I'm going to come down to your knee. This is the popliteal pulse. I'm going to feel. Strong pulse felt. Then I'm going to come to your posterior tibula. Okay, and then I'm going to come to your dorsus medialis. Can you lift your great toe for me? That's a good landmark to find it, okay? Okay, strong pulse felt in all 4 areas. No weak or bounding pulse noted. Okay, next we're going to check your range of motion for your hip. Can you take this leg, and I'm going to have my hand right here on your hip joint, feeling for any kind of clicking or any sounds or feelings. Lift this leg straight up. Very good. All right, now take your knee into your chest. Very good. Okay, rest it. Now, take your knee, place your foot on the bed, making a knee. There we go. Now I want you to rotate that leg, knee in and out. Very good. Very good. Okay, go ahead, heels together. Now I want you to do a abduct and a adduct. Oh, be careful. Okay, out and in. Go ahead and do it one more time for me. There we go. Good job. No clicking felt at the knee, so that's a good thing. Okay, lift this leg, and I just want to check muscle strength. Okay, push against my leg. Push. My arm, I'm sorry. Very good. Muscle strength present. You can go ahead and sit up. Go ahead and sit up for me. There we go. All right, we're going to check the foot and the ankle. So what I want you to do, point that toe down and up. Okay, side to side. And can you roll it for me? Very good. And what I want you to do, pull against my arm. Pull against it. Very good. Very good. And we're going to check your knee when you stand up. But while we're here, let's check your patellar reflex. Your knee is called your patella. I'm going to come right here and find the tuberosity. And what I'm going to do, I'm just going to do a light tap. Light tap. Okay. Then on the side. When I tapped on the beginning, the leg went up, so that's good. Okay, come over here and stand up for me. And what I want you to do is check your knee. Just do it up and down for me, both knees. This is a reflex. Very good. Very good. All right, now let's do your lumbar text while we're here. This is checking your cerebellum. So what I want you to do is close your eyes. Feet together, heel together. Okay, I'm going to count to 20. 1, 2, 3, 20. Go ahead and open your eyes. And what I want you to do is lift one foot. Okay, go ahead and lift the other one. Very good. It is present. That's a good thing. Let's go ahead. Let me look at your extremities. Skin is warm, dry to touch, intact. Finely distributed hairs evenly. Very good. Next thing, I'm going to check upper body strength. So what I want you to do, I'm going to put my hand on your shoulder. And what I want you to do is go all the way up and all the way back, okay? Then go on. Very good. Then put your hands as high as you can in the back of on your back. Very good. Now I want you to do circle, circle, make a whole circle. No clicking felt when you do that. Okay, go ahead and put your hands behind your head. Now on this shoulder this time. Okay, range of motion is there. That's good on upper body strength. Okay, go ahead. I want you to make kind of like you're doing a princess wave. Turn for me. Very good. Let me inspect the elbow. No inflammation, not hot to touch. Let's check your strength. What I'm going to do, I'm going to do this, and I want you to pull against me, hard as you can. Okay. No crepitus or a clicking hurt felt with upper body range of motion and strength is present. Okay. Let's go ahead and check for scoliosis. We're almost done. So what I want, I'm looking at your shoulders. You have symmetry, which is good. Torso and arm length is the same. Go ahead and turn to the back and I'll look at the same thing. Symmetry with the shoulders. Torso and arm length is the same. Go ahead and bend over for me. Touch your knees. Very good. Even symmetry. And I'm just going to walk my fingers down the line. Even straight midline. You can stand up. So no scoliosis present. This concludes the assessment on 21-year-old female, Miss Mosley, in the hospital for upper respiratory infection. No abnormalities noted with the mouth, abdominal, chest. Scoliosis is negative. Upper body strength is present, and extremities, lower body strength is present. All pedal pulses, all lower pulses are present. This concludes our health assessment.